And the Board of Healthcare Funders is concerned by a rise in South Africa's health workforce deficit. CEO Dr Katlego Mothudi speaks to us in just a moment. Well, South Africa is facing a critical shortage of healthcare professionals. The doctor-patient ratio stands at one doctor for almost 3,200 patients. It's predicted there'll be a shortage of around 34,000 registered nurses by 2025 if urgent action is not taken. To discuss this even further, we're now joined by Dr Katlego Mothudi from the Board of Healthcare Funders. Doc, thank you for your time and good morning to you. I mean, why is this deficit at this stage? Seeing that there's one doctor for every over 2,000 patients, how do we get to this point?
Yeah, good morning and thanks for having us. I think the reasons for the deficit are varied, and it is important to view the health workforce provision, importantly now because we are talking about reforming the entire healthcare sector under the guise of universal health coverage. Now, the WHO recommends that when you look at the quality of your services, you should look at 6 pillars. One of them is health workforce. Now, the challenge of this deficit is a global issue. It's not just peculiar to South Africa or even to Africa. But when you look at the projections, both from the reports that are drawn from home and also from the WHO, they are concerning. While other countries by 2030 rather, the deficit may be reducing. For South Africa and Africa in general, it will actually be increasing. So it is important to look at both the supply side and also the maintenance of the health workforce to make sure that we've got adequate healthcare service provision.
Yeah, it's not only doctors in the healthcare, industry that face this deficit, Doc. It seems that nurses as well have this challenge. I mean, I'm looking at the 2030 Human Resources for Health Strategy report here, raising a similar flag that it seems that nurses by 2025 in South Africa alone will face a shortage of about 34,000 registered nurses if no immediate action is taken. How do we then bridge this gap when it comes to nurses?
When we look at these deficits, it's important to look at the various contributors. While one would argue that it's population dynamics that lead to maybe largely the deficit in terms of a population that is increasing at a faster rate than we can train healthcare personnel, and also an aging, especially for nurses, and aging healthcare personnel. We have to look at policies that affect the sector from all areas. The first one is looking maybe on the supply end. Are we having a good pipeline from high school in terms of vocational guidance, the quality of the learners that are coming through? Are we focusing on mathematics, healthcare related subjects, etc. The second thing is to look at the health workforce as a labor issue. Are we making sure that when we have qualified personnel, they are employed, they are happy where they are, and then they are empowered? Because one thing that could be a red herring is for us to match the statistics and say we are on par with what is recommended, but we don't realize what sort of access the population is having. In South Africa, particularly, while one may argue that when you look at the global or South African stats or overall stats, it may not look so bad. But if you look at the differences between the public and the private sector, it does become concerning. Secondly, there are challenges even when you compare the provinces where you, for example, the Western Cape might look to be on par with what's recommended, but when you compare to a province like Limpopo, it becomes alarming. So we have to look at broader policies from a leadership perspective, how we prepare people from quite an early age into the sector and then maintaining them. And then the other issues are economics. Global migration is still an issue. we still find healthcare professionals being drawn to other countries where they deem to be treated maybe a bit better.
With that being said, how will this then impact on, the implementation of the NHI, do you think?
It will have an impact from various factors. While I mentioned earlier that there are 6 elements that we need to look at when we reform our healthcare system, NHI forms the financing aspect. Now, from the financing aspect, the study that we are quoting, I think the healthcare strategy for 2020, indicate how much money we need to sink in to make sure that we at least have a semblance of adequacy come 2025 or 2030. What it means is that there's a lot more money that needs to be taken from the fiscals, firstly, to match the provinces, and also to make sure we start matching the needs for the citizens. I think one of the elements, the models that were used in that study, quote that by 2025, if we need to bring up I think the lower 4 provinces to up to the 3rd one, we need to invest at least about 40 billion rand into the sector. Now, this is money that is going to be taken from somewhere, and maybe also from healthcare service provision. So it does have some impact on our ability to first implement NHI, and also then to make sure that we provide the necessary healthcare services for the population.
All right, Doc. Well, I appreciate you speaking to me this morning, and that's all the time I had with you, Dr. Katlego Mothudi from the Board of Healthcare Funders, talking about the healthcare workforce deficit that we're not only seeing around the world, but also right here in South Africa.